Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing hypertension. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: hypertension, or high blood pressure, is a condition where the force of the blood against the walls of the arteries is consistently too high, typically over 140 by 90 mmHg. It is a common condition, but can be dangerous if left uncontrolled. Hypertension is a major risk factor for cardiovascular diseases such as heart attack, stroke, kidney failure, and other health issues. Causes of hypertension include genetic factors, unhealthy lifestyle choices, obesity, stress, and other medical conditions. Main symptoms: headache. Headaches, especially in the morning, can be a sign of high blood pressure. Dizziness. Feeling lightheaded or losing balance can occur due to high blood pressure. Nosebleeds. In some cases, frequent nosebleeds may be associated with high blood pressure. Chest pain. A sensation of chest tightness or pain may indicate cardiovascular complications related to hypertension. Fatigue. Patients may feel persistent fatigue and difficulty concentrating due to high blood pressure affecting the function of vital organs. Causes and risk factors. Genetics. If you have a family history of hypertension, your risk of developing the condition increases. Unhealthy diet. Consuming too much salt, fat, and lacking in fruits and vegetables can contribute to hypertension. Overweight or obesity. Excess body weight increases pressure on the arterial walls, leading to high blood pressure. Stress. Prolonged stress can cause temporary or long-term increases in blood pressure. Sedentary lifestyle. Lack of physical activity can weaken the cardiovascular system, increasing the risk of hypertension. Medication use. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and birth control pills, can raise blood pressure. Treatment options. Lifestyle changes. Increasing physical activity, maintaining a healthy weight, and eating a diet low in salt, saturated fat, and cholesterol can help control blood pressure. Antihypertensive medications. Drugs such as ACE inhibitors, calcium channel blockers, and diuretics are commonly prescribed to lower blood pressure. Stress management. Practicing relaxation techniques such as yoga, meditation, and deep breathing can help reduce stress and manage blood pressure. Blood pressure monitoring. Regularly monitoring blood pressure helps patients better manage their condition and adjust treatment as needed. Patient advice. Eat a healthy diet. Limit salt intake and consume more vegetables, fruits, whole grains, and potassium-rich foods to help regulate blood pressure. Increase physical activity. Engage in at least 30 minutes of exercise daily, such as walking, swimming, or cycling, to support cardiovascular health. Learn to relax and manage stress through deep breathing, meditation, or yoga techniques. Lose weight if needed. If overweight or obese, losing weight will help reduce pressure on the arteries and improve blood pressure. Thanks for watching. Like and subscribe to catch our next topic in the Common Health Topics series. See you soon.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing arrhythmia. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: Arrhythmia is a condition in which the heartbeat is irregular, too fast, or too slow. This can affect the heart's ability to pump blood effectively, reducing the amount of blood reaching vital organs. Arrhythmias include various types such as tachycardia, fast heartbeat, bradycardia, slow heartbeat, and atrial fibrillation. While some arrhythmias are harmless and cause only mild discomfort, others can lead to serious complications such as stroke, heart failure, or cardiac arrest. Main symptoms: fast or irregular heartbeat, a sensation of the heart beating fast, forcefully, or irregularly, especially at rest. Dizziness or fainting, feeling lightheaded, dizzy, or even fainting due to insufficient blood flow to the brain. Shortness of breath, difficulty breathing or feeling short of breath, especially when the heart is beating irregularly or too fast. Chest pain or discomfort, a feeling of pain or pressure in the chest, which may be a sign of a more serious arrhythmia. Fatigue, persistent tiredness or weakness due to the heart not delivering enough blood to the body. Causes and risk factors: cardiovascular disease, conditions like coronary artery disease, heart attack, or heart failure can increase the risk of arrhythmia. High blood pressure, hypertension can increase the risk of heart muscle damage and lead to arrhythmia. Heart valve disease, when heart valves are damaged or malfunction, blood flow within the heart is affected, leading to abnormal heart rhythms. Thyroid disease, both hyperthyroidism and hypothyroidism can affect heart rhythm. Stress and anxiety, prolonged psychological stress or anxiety can increase heart rate and trigger arrhythmias. Treatment options: medications, beta blockers, calcium channel blockers, anticoagulants, and antiarrhythmic drugs are used to control heart rate and prevent blood clots. Heart devices, pacemakers and implantable cardioverter defibrillators (ICDs) can help regulate heart rhythm and prevent serious complications. Electrical cardioversion, using electrical shocks to restore the heart's normal rhythm in cases of irregular or rapid heartbeats. Ablation, a procedure that uses energy to destroy abnormal heart tissue responsible for the arrhythmia. Surgery, in severe cases, surgery may be performed to remove or correct the factors causing the arrhythmia. Patient advice: reduce stress. Learning to manage stress through techniques such as meditation, yoga, or deep breathing can help maintain a stable heart rhythm. Eat a heart-healthy diet, a diet rich in fiber, low in saturated fat and cholesterol, and limited in caffeine and alcohol intake can help manage heart rhythm. Exercise regularly. Light, regular exercise such as walking can help improve cardiovascular health and regulate heart rhythm. Monitor heart rate. Regularly monitor your heart rate and symptoms, and notify your doctor of any irregularities to adjust treatment as needed. Thanks for watching. Like and subscribe to catch our next topic in the Common Health Topics series. See you soon.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing myocardial infarction. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart is obstructed or completely stopped, depriving the heart muscle of oxygen and nutrients. This is usually caused by a blockage in one or more coronary arteries, often due to the buildup of plaque or a blood clot. Without prompt treatment, the affected part of the heart muscle can die, causing permanent damage and potentially leading to death. A heart attack is a medical emergency that requires immediate treatment. Main symptoms: chest pain or discomfort, a sensation of pain or tightness in the center or left side of the chest, lasting for a few minutes or recurring. The pain may radiate to the neck, shoulders, arms, or back. Shortness of breath. The patient may experience difficulty breathing or shortness of breath, especially during physical activity or at rest. Excessive sweating. Profuse, cold sweating that occurs unexpectedly may be a warning sign of a heart attack. Nausea and vomiting. Some patients may experience nausea or vomiting during a heart attack. Dizziness or fainting. A heart attack can cause dizziness or fainting due to low blood pressure or reduced blood flow to the brain. Fatigue. Extreme tiredness or weakness, even without strenuous activity, can be a sign that the heart is not receiving enough blood. Causes and risk factors. Coronary artery blockage. The most common cause of a heart attack is a blockage in the coronary artery due to plaque buildup or a blood clot. High blood pressure. Prolonged high blood pressure increases the risk of arterial damage and plaque buildup, leading to heart attacks. High cholesterol. High levels of LDL cholesterol increase the risk of plaque formation in arteries, causing narrowing and blockage. Smoking. Smoking damages artery walls, reduces oxygen flow to the heart, and increases the risk of a heart attack. Diabetes. People with diabetes have a higher risk of heart attacks due to vascular damage and elevated blood sugar levels. Treatment options. Emergency first aid. If signs of a heart attack appear, call emergency services immediately. While waiting, the patient may be given aspirin to thin the blood and prevent further clotting. Thrombolytic drugs. In emergency situations, clot-busting drugs can be used to dissolve blood clots and restore blood flow to the heart. Angioplasty and stenting. This procedure widens a narrowed or blocked artery and inserts a stent to keep the artery open long-term. Coronary artery bypass grafting cabbage. In severe cases, bypass surgery may be performed to create a new path for blood to flow to the heart, bypassing the blocked artery. Medications. Anticoagulants, beta blockers, pain relievers, and blood pressure medications may be prescribed after a heart attack to prevent future episodes. Patient advice. Adopt a healthy lifestyle. Maintain a diet low in saturated fats and cholesterol, increase intake of fruits and vegetables, and exercise regularly to reduce the risk of a recurrent heart attack. Quit smoking. Quitting smoking is the most important step to protect heart health and prevent a future heart attack. Control blood pressure and cholesterol. Regularly monitor and manage blood pressure and cholesterol levels to maintain healthy arteries. Follow up with heart health monitoring. Regularly check your heart health and follow medical advice to maintain cardiovascular health after a heart attack. Thanks for watching. Like and subscribe to catch a next topic in the Common Health Topics series. See you soon.
Welcome to the Common Health Topics series by Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing stroke. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Stroke, also known as a cerebrovascular accident (CVA), occurs when part of the brain does not get enough blood due to a block or ruptured blood vessel, leading to brain cell damage. There are two main types of strokes: ischemic stroke, caused by a blood clot blocking an artery, and hemorrhagic stroke, caused by a blood vessel in the brain bursting and causing bleeding. Stroke is a medical emergency that can lead to death or severe complications if not treated promptly. Early recognition of symptoms and swift intervention can save lives and minimize damage. Main symptoms: face drooping. One side of the person's face may droop, or they may be unable to smile normally. Arm weakness. The person may be unable to lift one or both arms or experience sudden weakness in their arms. Speech difficulty. The person may have difficulty speaking. Their speech may be slurred, or they may be unable to speak at all. Time to call. If any signs of a stroke appear, it is crucial to call emergency services immediately for timely medical intervention. Other symptoms: loss of balance. The person may lose balance or feel unsteady, making it difficult to walk. Sudden severe headache. A sudden and intense headache may be a sign of a stroke, particularly a hemorrhagic stroke. Vision loss. The person may experience partial or complete loss of vision in one or both eyes. Numbness or weakness on one side. Sudden numbness or weakness on one side of the body, usually affecting the face, arm, or leg. Causes and risk factors. High blood pressure. Uncontrolled high blood pressure is a leading cause of stroke due to its damaging effects on blood vessels. Cardiovascular disease. Conditions such as coronary artery disease, atrial fibrillation, and heart failure increase the risk of blood clot formation and stroke. Diabetes. High blood sugar levels can damage blood vessels, increasing the risk of stroke. Smoking. Smoking damages blood vessels and increases the risk of both ischemic and hemorrhagic stroke. High cholesterol. Elevated cholesterol levels increase the risk of plaque buildup and blood clots, leading to stroke. Treatment options. Thrombolytic drugs. For ischemic stroke, clot-busting drugs can be used to restore blood flow to the brain if administered within a few hours of symptom onset. Anticoagulants and antiplatelet drugs. These medications help prevent blood clots and reduce the risk of recurrent strokes. Endovascular procedures. Endovascular treatments, such as mechanical thrombectomy, can be performed to remove a blood clot in the brain. Surgery. In hemorrhagic stroke cases, surgery may be necessary to repair the ruptured blood vessel and relieve pressure in the brain. Patient advice. Control blood pressure. Maintain normal blood pressure through a healthy diet, regular exercise, and taking prescribed medications. Manage cholesterol and diabetes. Follow a low saturated fat, low sugar diet, and manage diabetes effectively to reduce stroke risk. Quit smoking. Stop smoking to improve cardiovascular health and reduce the risk of stroke. Exercise regularly. Engage in at least 30 minutes of daily exercise to improve circulation and overall health. Thanks for watching. Like and subscribe to catch our next topic in the Common Health Topic series. See you soon.
Welcome to the Common Health Topics series by Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing anemia. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: anemia is a condition in which the body does not have enough red blood cells or hemoglobin to transport adequate oxygen to tissues and organs. Hemoglobin is a protein in red blood cells that helps carry oxygen from the lungs to other parts of the body. When anemia occurs, the body does not receive enough oxygen, leading to fatigue, weakness, and other symptoms. There are different types of anemia, including iron deficiency anemia, vitamin B12 or folate deficiency anemia, and anemia due to chronic diseases. The causes can include blood loss, reduced red blood cell production, or the rapid destruction of red blood cells. Main symptoms: fatigue. One of the most common symptoms of anemia is prolonged fatigue and a lack of energy due to the body not receiving enough oxygen. Pale skin. The patient's skin may become pale or grayish, especially on the palms, gums, or under the eyelids. Shortness of breath. The patient may experience difficulty breathing or shortness of breath even with light activities. Dizziness or headaches. Anemia can cause dizziness, lightheadedness, or headaches due to the brain not receiving enough oxygen. Rapid heartbeat. The heart may beat faster or irregularly as it works harder to deliver oxygen-rich blood to the body. Cold hands and feet. The patient may feel cold in their hands or feet due to reduced blood flow. Causes and risk factors. Iron deficiency. Iron deficiency is the most common cause of anemia, as the body needs iron to produce hemoglobin. This deficiency often results from a diet low in iron, blood loss, or poor iron absorption. Vitamin B12 or folate deficiency. Both vitamin B12 and folate are essential for red blood cell production. A deficiency in these vitamins can lead to anemia. Blood loss. Blood loss from injury, surgery, or health conditions like stomach ulcers, heavy menstrual periods, or bowel disease can cause anemia. Chronic diseases. Chronic conditions such as kidney disease, chronic inflammation, or cancer can reduce red blood cell production and lead to anemia. Genetic factors. Some forms of anemia, such as sickle cell anemia or thalassemia, are caused by genetic factors. Treatment options. Iron supplements. For iron deficiency anemia, taking iron supplements in pill form or receiving iron injections can help boost red blood cell production. Vitamin B12 or folate supplements. If anemia is caused by a deficiency in vitamin B12 or folate, taking supplements can help resolve the deficiency. Treating the underlying cause. If anemia is due to blood loss or a chronic condition, addressing the underlying cause is necessary. Blood transfusion. In cases of severe anemia, a blood transfusion may be necessary to provide the patient with red blood cells. Erythropoietin-stimulating agents. For patients with anemia due to chronic conditions, medications that stimulate red blood cell production, like erythropoietin, may be used. Patient advice. Increase iron and vitamin intake. If at risk for anemia, eat iron-rich foods like red meat, dark leafy greens, beans, and iron-fortified cereals, along with foods rich in vitamin B12 and folate, such as eggs, dairy products, and green vegetables. Avoid drinking tea and coffee with meals. Tea and coffee can interfere with iron absorption, so avoid consuming them during meals. Monitor symptoms. If you experience prolonged fatigue, shortness of breath, or pale skin, see a doctor for evaluation and diagnosis. Treat underlying conditions. If anemia is due to other health conditions, such as bowel disease, infections, or chronic blood loss, addressing those conditions is essential. Thanks for watching. Like and subscribe to catch our next topic in the Common Health Topics series. See you soon.
AVN Pharma Education.